We shall now do stimulation single fiber jitter study in the tibialis anterior muscle. For this we usually use two needle stimulating electrodes, which are fine monopolar needles insulated close to the tip. We could use, for example, just needle cathode and the surface anode, but for large muscles it is advisable to have both electrodes as needles. So now I shall introduce the needles while stimulation is going on, and we have a stimulus of 1.2 to 1.5 milliamp, very short duration, the shortest available in your equipment. This is 0.04 millisecond in this case, and the frequency is 3 Hertz, because this is the frequency where we can very easily and nicely see the twitches. So as the motor end plates are widely distributed in the muscle, it is not so crucial where you insert the needles. And now we shall just see if any one of the two needles is jerking at 3 Hertz. We see in this case both are jerking. And then we simply palpate the muscle, and we feel the contracting strand of muscle fibers. And here we shall introduce the single fiber EMG electrode. We could do it either proximal or distal to the stimulating electrode. So now I shall introduce the recording needle, but before that I ask the patient whether this stimulation is painful.
No, it's not painful.
Can you feel the stimulus?
I don't even feel it.
You don't even feel it. In fact, many patients fall asleep during this study. Now I introduce the recording electrode, in this case close to, about 20 millimeters away from the stimulation electrode. We see a composite spike, which is certainly not good for our purposes. We want to have single fiber action potentials. But let us first increase the stimulation rate. Now this is 10 Hertz, which is most often the frequency most often used. This may not be just one potential. Apparently we are close to a bundle of motor axons which have very similar thresholds, so we cannot well isolate a few and stimulate them well above the threshold. And this is usually an indication that we have to change the position of the stimulating electrode. So now this is a recording which contains one measurable potential. Well, now we lost it. Now it is here again. The smaller potential which precedes it is a composed spike, so it cannot be used. can look through the recording and see that most of it is acceptable until here. Now we have to discard this portion, but previously it was also acceptable. So could we use, if we use just this last part, that would give a reliable jitter value.